Most of what you hear about teen depression comes from urban or national data. But what happens when we zoom in on rural teens? Today, we're exploring why rural teen depression can look different, not because rural teens are overly dramatic or just shy, but because their environment, access, culture, and community shape how symptoms show up and how they're recognized. This video strictly summarizes research. No medical advice, just science. Depression during adolescence can include low mood, loss of interest in activities, changes in sleep and appetite, difficulty concentrating, and sometimes suicidal thoughts. These symptoms are common across settings, but how teens express them and whether they get support can vary significantly depending where they live. Research shows that depression symptoms among adolescents sometimes occur at similar rates in rural versus urban areas, but that doesn't mean the experience is the same. For example, a large study of U.S. teens aged 12 to 17 found that while rates of depressive symptoms and serious suicidal thoughts didn't significantly differ by rural versus urban residents, the overall high rates highlight how important intervention is in all areas, including rural ones. Other international studies also find significant depression rates among rural youth, such as a study of adolescents in rural Mexican communities, where many teens exhibited meaningful depressive symptoms and suicidal ideation. Rural areas often have fewer mental health professionals and services, including fewer school counselors and psychologists, which means teens might not have early support or diagnosis. Research over decades has shown rural residents generally receive less specialty care for depression than urban residents. Not only that, recent work shows rural teens are less likely to use digital tools like mental health apps or online therapy despite facing similar levels of symptoms as urban peers, partly because of internet connectivity issues, privacy concerns, and community stigma. Rural communities often have strong norms around self-reliance and toughness, which can shape how depression is talked about or whether it's talked about at all. When teens grow up hearing things like "shake it off" or "you're fine," they might be less likely to label their feelings as mental health issues, even if they're struggling. This can delay help-seeking behavior or change how their symptoms are expressed in ways that look different to clinicians or peers. This is a sociocultural factor, not a flaw in the teen, and it shows how context matters. Family structure and environmental stressors also differ. In some rural areas internationally, teens who live apart from one or both parents, such as children whose parents migrated for work, show higher levels of depressive symptoms, likely due to loneliness and disrupted family support. Studies from China, for instance, found that academic performance, parental absence, and school stress were significant predictors of depressive symptoms in rural youth. It's important to note that while these are different contextual factors, they interact with universal developmental risk factors for depression: stress, social isolation, family conflict, meaning rural life doesn't create depression, but it may shape how it shows up. So how might symptoms look different? Some research suggests that emotional experiences like guilt, anxiety about uncertainty, or appetite changes may tie differently to broader depression symptoms in rural versus urban youth, potentially shaped by different family expectations, economic stressors, and resources. Another study shows that peer and family relationships in rural settings may have stronger influences on mental health networks, meaning social ties or their absence could change the emotional and behavioral pattern of depression symptoms. There's also evidence that while prevalence rates might sometimes not drastically differ, the network of symptoms, what is connected to what, may look different in rural adolescents compared to urban ones. So if rural teens might experience depression differently, what does this mean? It doesn't mean rural teens' feelings are worse or less real. It means that support systems need to factor in access barriers. Care approaches might need to be adapted to cultural context. School, community, and family outreach becomes more important. Digital tools need to be equitable and culturally appropriate. Research consistently points to persistent gaps, geographically, digitally, socially, that impact how rural adolescents engage with mental health supports. Depression in teens is serious everywhere, but rural contexts introduce barriers, norms, and lived experiences that can change how depression appears and how it's addressed. By understanding these differences through research, we can promote more compassionate, effective psychoeducation and advocacy. If you found this helpful, leave a comment below and subscribe for more evidence-based psychology breakdowns here on Psych in Context.